Hi everyone, most important thing I will discuss today, that is the Palmar spaces. I think everybody, you will appreciate this discussion.
Start.
The palm, everybody possesses the palm, and this is the known as the manus, which has got a palm and the dorsal aspect. Now the palm, you see, the skin of the palm, it is very much thickened than the skin of this region, and this skin has got no sebaceous gland. That means sebaceous gland is present when there is hair, but in the palm nobody has got hair within the palm. And this skin is thick skin, example of the thick skin. And in the palm you will see there are some skin creases, and the creases are the flexure lines. These creases does not correspond to the joint, but these creases helps to flex your joint, move the joint apart. So for this reason these creases are formed. And somebody also studied these creases as an horoscope. Now you see that the thumb, there is some elevation below the thumb. This elevation is known as the thenar eminence, and this is the little finger, and in this below there is another little elevation. This is known as the hypothenar eminence. Now this thenar eminence is due to the thenar muscles, and these thenar muscles are very strong. Why it is very strong? Because our thumb perform more laborious job. Without thumb you cannot grasp it well. So this muscles is situated here. In the middle there is a hollow. That means here muscles are very tiny and not so prominent. And in the latter part there is the hypothenar muscle, that is like that of the thenar one. There is the 3 hypothenar muscle. But the opponent's digiti minimi performs a very little function, but opponent's pollicis performs a good function, so that the opposition is possible, for which the human being is superior to any other animal. Nobody has got the power of opposition. Now you see, is this central portion. You see this hollow. So you look at this dissection. There is the incision from the radial styloid process to the ulnar styloid process. Then another incision along the roots of the fingers, and whole of the skin is lifted out along with the superficial fascia, that means that contains fat. Not only that, here you will get a aponeurosis, which is absent here, because that aponeurosis, you will remove this aponeurosis. So you see, this is the aponeurosis. If I place it here, you see this is the Palmar aponeurosis, that is the thickened deep fascia, or somebody says that palmaris longus expansion is the Palmar aponeurosis. So this Palmar aponeurosis is sends 4 slips for the 4th finger. So you will see between the slips you will see some branches of the artery and some white color thing that is known as the tendon. Tendon means when you move your hand, you will see some cord like structure is moving, that is known as the tendon. White tissue, and that is formed from the muscle during the time of its insertion. So if I remove this flexure retinaculum, then below the flexure retinaculum you will get the structure which is very deeply situated, that is the deeply situated than this Palmar aponeurosis. This is the superficial palmar arch. And due to the superficial palmar arch, deep palmar arch, there is the palm is more warmer than the dorsum of the hand. So you will see here below there is the space. You will look, this is the thenar muscle, this is the hypothenar muscle, and between the tendon you will get some space. Below this, Palmar aponeurosis. So how this space is formed? From this aspect, I will see, from the medial aspect, if you see, a partition goes from the Palmar aponeurosis up to the fifth metacarpal bone. This is the fifth metacarpal bone. So you will see here, this is the one partition. Another partition you will see that will goes from here up to the third metacarpal bone, from here. So if you see, when there is this type of attachment, there is formation of the space. You see, here there is space, that space is not so big. But why there is important of this space? Because the you see the peronaichia, that means infection of the nail, infection of the palm is very common. Particularly in case of laborer, in case of female who washes the fish, there may be bite of this fish nail inside this, and they will create infection. So that infection that spread within this space, and it is limited because it is within the trunk partial sheath, but it will produce a severe pain. So that's why this space, one space is on this size is known as the mid-palmar space, and space is here, it is known as the thenar space. So when there is infection, one should actually go to the doctor to immediately relieve this infection. Now I shall show you how easily you can draw the picture of the hand in the examination. You place your hand and then you put your pencil or pen around these fingers, and then in the examination you will see there is always the palmar spaces, or sometimes the muscles of the palm will come. So you will get here, and here you will get the ventral aspect of the palm margin, and how you will draw the thenar space, that is towards the thumb. You will get the thenar space, and towards the little finger and below the ring finger you will get the mid-palmar space. So this is the drawing during the examination. So thank you everyone for watching this video.